Good morning. I'll be speaking about decreasing the numbers of uninsured and increasing access to health care. Because of a lack of affordable, accessible health care in the United States, many of our citizens suffer from higher rates of preventive illness and death. Physicians, the natural leaders for health care in the United States, have been silent as others have debated and passed various safety net legislation that has helped, however, has not been able to reduce overall health outcomes. And we believe that it's because these safety net programs have a lot of holes, and large numbers of poor people are not able to get access to health care. So it's time for physicians to come together as a group and work with our legislators to create a better health care plan for our state and for our country. There were two landmark studies that were done by the Institute of Medicine. The first was done in 2002. The title, Care Without Coverage, Too Little, Too Late. And the second was done in 2009, America's Uninsured Crisis, Consequences for Health and Health Care. The findings of Care Without Coverage was that for the uninsured, they were less likely to receive timely services and preventive health screening services. The uninsured had delayed diagnosis and poorer outcomes when it came to cancer diagnosis and care. For chronic diseases such as hypertension and diabetes, the uninsured were less likely to receive appropriate care and had worse outcomes. For cardiovascular disease, fewer life-saving procedures were done, and less invasive testing was done, and there was a higher mortality suffered by the uninsured. When they looked at hospital-based care, they saw higher rates of death in the hospital in 30 days post-hospitalization. The uninsured had fewer services and were more likely to experience adverse medical events. The likely causes for, and also there was a new finding in 2009, and that was that there was a significant increase in the numbers of uninsured. And the primary cause of that was that we were in a recession during that time, and the economy in the U.S. was shifting from manufacturing to service. And in the U.S., most of the population obtained insurance from employers. And so there were more people unemployed, and most of the insurance came from the manufacturing industry, which was decreasing. So that led to the crisis that we were having in lack of health insurance. The commission concluded that in the United States, data show that health insurance coverage is integral to health care and access to health. And they recommended that action was needed, and action was needed now. They made a recommendation to the president and to Congress to achieve universal health care coverage by 2010. Of course, we know that didn't happen. However, we did have the Affordable Care Act passed in March of 2010, and the primary way for getting people coverage was through Medicaid. Medicaid is a state and federal health insurance program for low-income individuals, and it serves as a safety net for pregnant women, for children, for certain people with disabilities, and for the people in nursing homes. However, coverage is intermittent and limited to those groups that I mentioned there, and thus there are large numbers aged 18 to 64 who are uninsured, and these are the ones in the so-called coverage gap. The goal of the ACA was to provide health care insurance coverage for more Americans and decrease the number of uninsured primarily by expanding Medicaid and having more people be able to participate in healthcare, state healthcare exchanges. And this was for those earning 400% of the federal poverty level, and they were able to enroll in health insurance plans which were subsidized by the federal government. So after the act was passed, we saw the uninsured rate in the United States drop from 2010, when the ACA was passed. There was around 48 million uninsured, and by 2016, there was less than 28 million uninsured. And for the first time in U.S. history, our uninsured rate was less than 9%. And this is just a graph to show the drastic change that occurred after the ACA. And this is a state-based graph showing that the states that were darker color were primarily in the South and Southeast, and a lot of these states did not expand Medicaid. This graph was to show how North Carolina's rate dropped along with the U.S. rate during this same period of time. However, North Carolina did not expand Medicaid, and this left approximately 380,000 adults who could have obtained health care insurance without it, and these are the ones that we say are in the coverage gap. This was an interesting study that was done by Sommers and his group, and he looked at mortality and access to care among adults after state Medicaid expansion. He looked at states that expanded and compared those to states that did not expand. And Medicaid expansion was associated with a significant decrease in all-cause mortality. And they projected that 2,480 fewer deaths per year would occur in states with Medicaid expansion, in which at least 500,000 adults acquired coverage. Again, we did not expand, and this slide is from the Center of Health Policy and Research and the Cone Health Foundation, and it just lists some of the costs of not expanding: the loss in federal funding, jobs not created, state tax revenues lost, and loss of rural hospitals. I've been in practice in North Carolina for over 25 years, and I've worked with a number of physician and physician-led groups. And I found that all of these groups were working toward the same goal: increasing access to health care and decreasing the number of uninsured. So I felt that we probably should start working together and talking to one another and see if we can collaborate on these issues and go to our legislators and see if we can help on health policy decisions. I conducted interviews of the groups that I had been working with after I formed a basic statement on what the problem was, and I wanted to see specifically how these organizations felt that we could best expand, could best affect the problem of lack of access in North Carolina. I spoke with Mr. Bob Seligson, the CEO of the Medical Society, and he, of course, stated that they were really working hard on Medicaid expansion, and he also mentioned that as we work on Medicaid expansion, we have to remember that the social determinants of health are also going to affect health outcomes. He did say that the North Carolina Medical Society does not support single payer or Medicare for all. One group, Healthcare for All North Carolina, for all NC, does support single payer or Medicare for all. The other groups are working toward Medicaid expansion. For a number of years, I worked with North Carolina Medical Society as well as the Old North State Medical Society and Foundation. And in 2008, I got involved with Doctors for America. Doctors for America is a grassroots sort of organization for physicians who were interested in addressing some reforms to the health care in the United States. I got involved with this group because whenever I saw discussions about this crisis that we're in, I saw legislators, lawyers, I saw clergy, I saw insurance industries, but there were not enough, I didn't see any physicians in the discussion. And we're the healthcare leaders. We need to be a part of this discussion. And a lot of things that I heard I wasn't comfortable with, and I knew that some of the statements coming from our politicians about healthcare were just wrong. So I decided it was important that we get involved. Instead of just the day-to-day care of our patients, we have to get politically active in order to make our system better. So I joined Doctors for America and went to Washington, and we did advocacy training and worked with our former Surgeon General, Dr. Vivek Murthy, as well as Dr. Alice Chin, who were the founders of the organization. And I was really impressed by their dedication and their passion for improving healthcare in the United States. So we, along with around 16,000 physicians from across the U.S., decided to work on getting access to healthcare through working on the Affordable Care Act before it was passed, as well as afterwards. The last group I mentioned, Healthcare for All, NC, I joined that group more recently because I truly feel that universal access is the best way to go. But that is going to be tough in this climate. And Dr. Jonathan Koch, who is the president of that organization, is really passionate about Medicare for All. But we certainly realize that even though we are getting more conversations in this area, and there have been several bills that have been introduced that support Medicare for All, we have a long way to go before that becomes a reality, if it ever does. So we made an agreement to collaborate with other physician groups and physician-led groups and to work with our policymakers to expand healthcare coverage in North Carolina and try to improve North Carolina's health status. My next step will be to go to our legislators and discuss this with them and see how we as physicians can have a voice in these policies and get their feedback and bring it back to the groups. I hope that we will eventually be able to form a healthcare advisory group to assist with legislation and policies. Concluding, why should physicians lead? Physicians should lead because we're the natural leaders of healthcare. We see all of these other people leading that really don't have a lot of experience. And every day we see our patients, we see the result of what happens when you don't have access to health care. And I feel that we can do a better job if we get involved. So I do have a quote from James Rennerson, and he said it best when he said, "Leaders examine the current situation, look ahead to future possibilities, and recognize the need for improvement. They then create a new system or change the system from what it is to what it should be. Leadership is action. It's not a position. Leadership is not victimhood." It's easy to say, as physicians, that we can't do this or that because of the insurance industry, because of government regulation, because of big pharma, the administrators. However, when we accept these statements as fact, then we accept ourselves as victims instead of the true leaders that we are. Physician leaders need to examine our healthcare system, look forward to a better system, and take action to make it better. Thank you.